Hi, I'm Dr. Radha Krishna. The topic today will be the role of bioinformatics in personalized medicine. Introduction to personalized medicine in bioinformatics is that as a personalized medicine treated at individuals or tailor-made to individual patients based on their unique. Number one would be the genetic makeup, the lifestyle, the environmental factors. Bioinformatics, that interdisciplinary field of biology and computer sciences, play a pivotal role in realizing the potential of personalized medicine by harnessing the computational tools, methods to analyze vast amount of biological data. Bioinformatics enable the precise identification of genetic variants, biomarkers, molecular pathways that underline disease susceptibility, progress, and response to treatment. This introduction highlights the indispensable role of bioinformatics in revolutionizing healthcare delivery by facilitating the translation of genomics, clinical data into actionable insights of personalized diagnosis, prognosis, and the treatment selection. Bioinformatics is essential for personalized medicine, leveraging computational analysis of biological data to tailor-make medical treatment to individual patients. It enables several data based approaches. And I would like to give a real example of a case I faced and how bioinformatics could have helped these patients to overcome the side effects through the bioinformatics personalized medicine. The role of bioinformatics in personalized medicine have subdivided into seven sections to help to understand the basis of bioinformatics like genomic analysis, pharmacogenetics, disease diagnosis, precision oncology, clinical decision support, data integration, and patient stratification. Under genomic analysis, so here the identification of genetic variations influencing the disease risk and the drug response. In a branch of genetics, that focus of studying the complete set of genes within an organism's DNA is known as genome. It involves sequence determination, annotations, characterization, identification of genetic variants, and functional genomics and clinical genomics. Pharmacogenetics, it's about predicting the drug efficacy and adverse reaction based on the genetic makeup, a study of how an individual genetic makeup influences the response to drugs. These fields involve genetic variation in drug metabolism, efficiency, safety of certain drugs, drug development, precision medicine. In essence, genomics offer a personalized approach to disease uh, using the drug therapy, considering an individual genetic makeup, ultimately leading to safer and more effective treatment. This is a screen capture from my WhatsApp to show that I have been referred, a patient has been referred to me by another doctor. The script goes like this: is, hello doctor, I was referred to you by my friend Dr. Prema. My wife recently diagnosed with mesenchymal chondrosarcoma and undergoing chemotherapy. I'm keen to find out more on 360 Wellness Hub and the treatment options we can explore around the molecular medicine. Please let me know when would be a good time. I can give a call anytime this evening or tomorrow. Thanks, Bhuvan. Then I returned there, hi, are you a doctor? She said, and the reply is, I'm not a doctor. I said, okay, how can I help you, please? And then the reply was, I just want to understand the treatment options available, the type of cancer my wife has, and wanted to speak to you to get some insights. And I asked her, what is the current treatment going on? And then she said, he wrote back, this chemotherapy completed 2 cycles with doxorubicin. Was prescribed doxorubicin, infosfamide, etoposide, and total alternating 14 cycles. By so far, has been only on doxorubicin. She has been diagnosed to have metastatic mesenchymal chondrosarcoma, something very, very unusual affecting the soft tissues. And further inquiry, I found that it has involved the bone now. They just started the chemo, and currently the wife has lost all the hair on her head and the eyebrows, and has become a little intolerant to the doxycycline after 2 cycles. So the current regime, according to him, is that infosfazamide and etoposide upcoming cycles. Currently having 2 cycles completed on the doxorubicin, and currently they plan 14 cycles, and he is not sure that there will be more harm coming in, as already after 2 cycles they develop complications or massive side effects. And the patient, his wife is a pharmacist and he is an engineer. A quick survey on the drug doxorubicin showed that it affects the mitochondria, especially targeting this specific mitochondria, and there's a damage to DNA. And on a long term, there could be a possibility of cardiomyopathy. This is why at this stage, using bioinformatics, the approach to it with personalized medicine and precision pharmacology we could have done, or pharmacogenetics. And I think numerous patients with cancer would benefit from this personalized medicine. And I believe strongly that this is a subject that has to be widespread and help many other patients suffering from similar episodes. Disease diagnosis, it's not based on symptoms, it's based on early detection, risk assessment through genetic markers. To help to reduce the risk, early detection, risk assessment, precision medicine is incorporating genetic markers into a disease diagnosis, enabling precision medicine approach tailored to individual patient's genetic predisposition. Screening programs are essential for family history assessment. Overall, disease diagnosis through genetic markers offer opportunity for early detection, risk assessment, personalized intervention, enhancing preventive medicine efforts, improving health outcomes for individuals at risk of hereditary or genetic influences conditions. Precision oncology. Under this topic, is an exciting field that targets cancer treatment based on the molecular profiles. Precision oncology involves tailoring cancer treatment strategies to the specific molecular profile of an individual tumor. Molecule profiling involves analyzing its genetic, genomic, proteomic, and other molecular characteristics, identifying the driver mutation involving oncogenes, targeted therapies, and like small molecule inhibitors or monoclonal antibodies and immunotherapy, etc. The most important step involves personalized treatment plans, which are a combination of targeted therapies, conventional chemotherapies, radiotherapies, surgery to reduce the side effects. The prognosis, we use biomarker-driven decisions along with the adaptive therapies approach in an event like drug resistance. While clinical trials research are developed novel therapies agents. Here's a sample of diagrammatic representation of what precision oncology is all about. We are taking a client or a patient, and this patient is phenotyping done, the standard clinical analysis, tumor biopsy, tumor omics profiling, and the post-omic profiling. And from here, we develop the precision oncology in terms of treatment and to have less side effects or tumor-targeted therapies. Clinical decision support. This is based on algorithm. This algorithm is based on the integration of the patient's data consisting of electronic health records, genetic profiles, imaging, lab reports, lab tests, And this patient's management is based on evidence-based recommendation and the risk assessment and stratification, which is a predictive modeling of algorithm and help in preventive interaction. So when the drug-drug interaction or allergy checks is a potential health concern, so clinical optimization allows the automation of the delivery system and allowing the shared decision monitoring, making monitoring and surveillance. Data integration. It involves the four sections. The first section will be the genomics. The genomics involves the field of biology that studies the structure, function, evolution, mapping, and editing of genomes. The second part will be the transcriptomics, where is a study of complete set of RNA transcripts produced by the genome, one or more cells in this particular condition. The third part is the proteomics, a large study of the proteome, which allows us to identify the specific proteins expressed in a certain way. Then the last part is the metabolomics, which involves some of them is like a TCA cycle, where the systemic study of the processes involving metabolites, small molecules, substrates, intermediaries, and the products of cellular metabolism. Data integration. Data integration is a bioinformatics. I just have shown the previous slide about the diagrammatic representation. Here it refers to the process of combining the heterogeneous biological data from multiple sources to gain a comprehensive insight into complex biological processes, so it reduces the human error. So the multi-omic data integration, which various optic disciplines including genomics, transcriptomics, proteomics, metabolomics, and epigenomics. Epigenetic involves where the influences on the genes. It's a structure interplay between the biological processes and the molecular signature associated with health, disease, response. I believe this is brilliant because it involves not only the actual data of the human and the actual effects involving disease and actual expansion in the end. So from a practical point of view, I think this is brilliant. The data integration, vast amount of data such as genetic sequences, protein structure, and the pathways information, which allows researchers to share access and analyze efficiently. As I went through this bioinformatics under the guidance, it surprised me the depth of the crosstalk of these data based on thousands of researchers across the globe. And I believe it's a very exciting subject. Network integration is an approach to integrating biological data into network or graphs representing the molecular interactions, regulatory relationship, functional association. Researchers find the relationship between the genes, proteins, and the pathways. And this is, I think, very exciting. By associating the molecular entities with the functional annotations, researchers can interpret their biological insignificance and infer their roles in the cellular process disease pathways. Bioinformatics also uses utilizing machine learning, statistical integration to integrate data. What is the patient stratification? Patient stratification refers to a process of categorizing patients into distinct subgroups based on specific molecular or clinical characteristics. This leads to more targeted and personalized treatment. This involves molecular subtyping is based on genetic expression, patterns, genomic alteration, epigenetic modification, and influences of genes. So influences of gene basically is also known as epigenetic influences, where it influences the gene. In addition, the clinical characteristics like gender, disease stage, an example I posted earlier, comorbidities, treatment history will help to identify the subgroups for treatment response. The best part is the predictive biomarkers, which is measurable for treatment response. That means we can have a baseline predictive model before and after treatment. With this model, precision medicine can be tailor-made to maximize treatment, targeted treatment. Treatment selections with clinical trials design improve targeted approach to effective personalized treatment with minimal side effects. The keyword here is minimal side effects. Ultimately, the outcome prediction by stratifying patients based on their risk factors. Treatment response. Patient stratification help predict clinical outcomes, informed treatment decisions, and improve patient management and care coordination. For cancer, I've just driven that where you have done a preclinical research, clinical trials, approved, and prescription. So this is an inefficient procedure where the drug response is complex molecular, not based on few genes. So in a complex pattern controlled drug response where the genomics and the transcriptome comes in play, where we narrowly focus and give very targeted personalized treatment. This is a comparison graph to show that in the traditional medicine where we give a treatment of choice, but we have to encounter the adverse event or adverse effects of the drug. Maybe they have no benefits or they have benefits. So we will do a trial like a PET scan after 3 months for cancer to see whether the drug is really acting or whether it is sensitive to that particular drug. While stratified medicine involves group by disease subtypes, risk profile, demographics, socioeconomic factors, clinical features, biomarkers, molecular subdivision, and the therapy. If you look at a patient's group, benefits more from targeted approach. In the precision medicine, the individual patient's genomics and omics, lifestyle, preference, history, health history, medical record, compliance, exogenous factors. These can be involving the epigenetic factor, and there's a companion diagnostic biomarker. Okay, and the treatment will end up with patient benefits from individualized treatment, more targeted treatment with less side effects or almost nil. But the major part is that we can target that particular, like say for example, cancer with minimal side effects. In conclusion, bioinformatics plays a critical role in the personalized medicine by analyzing the genomic data to identify genetic variation influencing diseases, risk, treatment response. It enables the pharmacogenetics, predicting medications efficiencies and adverse reactions based on the genetic makeup, guiding precise drug selection and dosing. I think this is very, very important. Because you don't need excess dose and it will give you exact amount of precise dose. Generally, it has to be weighed on various factors. Additional bioinformatic aid in disease diagnosis that through early detection, risk assessment, using genetic markers, clinical data, precision oncology benefits the bioinformatic by analyzing tumor molecular profiles, guiding personalized cancer treatment like targeted therapies, clinical decision support, systems driven by bioinformatics, integrate patient data, computational algorithm, aiding personalized treatment, decision at the point of care. That's very important. Data integration merges the genomics, transcriptomics, and clinical data, providing comprehensive insights into disease mechanism, treatment strategies. Bioinformatics also facilitates patient stratifications in clinical trials, ensure treatment targeted population most likely to benefit. Overall, bioinformatics-driven approach in personalized medicine, optimize patient care, treatment outcomes, and it translating the complex biological data into actionable insights for individuals diagnosed and treatment What I like the most is that it translates a complex biological data into actionable insights. This is an amazing subject. Thank you, Dr. Yam, for giving me the opportunity to learn from you. And Dr. Radha, signing off.